was an abandoned learning center for Ghana Health Service that was left undone after President Akufo-Addo left the scene. This was left sitting here for 8 good years and nothing happened. So if you are talking about abandoned projects, Your Excellency, this is one of them. We had come to try to resolve the project with the support and massive assistance from UCG, and we thank them very much for helping us.
I'm really excited to be here this afternoon. When the pandemic hit us, one very important consequence that I took from it was that we needed to develop as quickly as possible a much more efficient health infrastructure than what we had before the pandemic. And that is why government committed itself to the program of Agenda 111, which was to build in 101 districts that did not have district hospitals in the course of the next year, to build 7 new regional hospitals, one each for the 6 new regions, and 1 new one for the Western region, and also with the rehabilitation of Efiankwanta in Secondary. We also committed ourselves to building 2 new psychiatric hospitals in the Northern and Middle Belt, and also infection disease control centers. It's obvious, like in everything that we're doing, that we have to help ourselves. Nobody will come in and help us if we do not help ourselves. And so to come here today and to see this collaboration between public and private entities and the government of Ghana to put up this very critical infrastructure in our fight against the COVID-19 is something which is very reassuring and very warming to my heart. Every disaster, every challenge is an opportunity. And that is the way we should look at where we are with this COVID-19. It has come, it's caused disruptions, but out of it, we should emerge a stronger country than we were before the COVID-19. That is my commitment, and that is what I'm working for, that we will come out of this thing stronger than we were before we went into the COVID-19. Let's look after this facility well and make sure that it is well maintained so that it can serve generations and generations of Ghanaians to come. May God bless us all and bless our nation, Ghana. Make us. Good to be back in Birmingham, headquarters of the Ghana Armed Forces. I'm here this afternoon to present 10,000 hospital beds and the government's Infrastructure for Poverty Eradication Program, IPEP, to hospitals across the country, which have been warehoused in the premises of the Ghana Armed Forces. We're grateful to the Armed Forces for their assistance in this and other areas of our national life. You may recall that in the run-up to the December 2016 elections, the implementation of IPEP was a campaign promise of my party, the new Patriotic Party. This pledge was to provide each of the 275 constituencies with a CD equivalent of $1 million to tackle issues relating to infrastructural development, and poverty eradication in rural and deprived communities. The implementation of the program commenced with the launching of One District, One Warehouse component in Ejura in the Ashanti region, followed by the unveiling of the One Village, One Dam program at Kuyuku in Laura in the Upper West region. One of the fruits of this policy was seen by all Ghanaians in February this year when I commissioned and distributed 307 state-of-the-art ambulances. That is one ambulance per constituency, and the remaining 32 to the National Ambulance Service. These ambulances have thus far been of immense help to ensuring an effective emergency medical service EMS system and improving our country's emergency response capabilities. Indeed, the Ministry of Special Development Initiative, which is implementing IPEP, together with the Coastal Middle Belt and Northern Development Authorities, have so far seen to the construction of the following: 1,000 community water systems, 1,000 public and institutional water closet toilets, 50 prefabricated grain warehouses, 560 small earth dams, 50 rural and peri-urban markets, 26 clinics with bungalows for the medical staff, and some 5,014 constituency-specific projects, and adding another plank to the IPEP initiative, and that is the supply and distribution of 10,000 hospital beds to hospitals across the country. It is always disconcerting to see patients being treated in wheelchairs, in plastic chairs, and even on the floors because of the unavailability of beds. The government's determination to see an end to this no-bed syndrome has resulted in the decision to procure these hospital beds and their associated accessories for distribution across the country to augment the existing numbers in the country. In total, 1,500 pieces of critical care beds with overhead tables, 2,000 pieces of standard hospital beds with bedside lockers, 4,000 pieces of health center beds with bedside lockers, 1,000 pieces of children's cots, and 1,500 pieces of delivery beds have been purchased. Accordingly, I declare the 10,000 hospital beds duly commissioned. May God bless us all and our homeland Ghana and make her great and strong. I thank you for your attention.